Dr. Lucas, the pandemic may be stressful for people, fear and anxiety about what could happen. What are some suggestions on ways to cope with these emotions?
Well, basically, you need to try to keep your life as simple and as straightforward as possible. What you want to do is try to live your life the same way you did before, obviously understanding that there are issues such as socially distancing, wearing masks, and all the things that constantly remind us that things are not the same. However, you want to still try to get that day of it. You want to get your exercise every day. You want to eat well. You want to avoid alcohol. Obviously, if you're smoking, try to limit cigarettes or stop cigarette smoking. Anything that you can do to be healthier. Take some time out to meditate, to pray, to do all the things that we need to do every day to kind of center ourselves and try to help to reduce that anxiety, which is understandable. Maybe you want to stay off the social media. That has been very toxic for many people these days. News shows can sometimes tend to increase our anxiety and increase our sadness as we deal with these issues. It's good to get information, but you don't want to flood yourself with all the ever-changing statistics and ever-changing ideas. Just try to take some time to calm yourself down and work to be healthy.
So, are you seeing these fears and anxieties common in both adults and children?
We're seeing it in both, all age ranges, children to geriatric patients. Everybody seems to be feeling this. It's just as, I've been doing this for a long time, and I've never seen the volumes of people calling the office, needing to talk to somebody. Primarily it's needing to talk. They feel very isolated, they feel very alone. We're fighting this enemy, but we don't see it. We know it's there, but we just see the reactions that other people have, and people are fearful, they're anxious, and so that tends to feed on itself with other folks. So yeah, a lot of people are calling, and it's very, very busy.
Dr. Lucas, you mentioned you're seeing a lot more people, a lot more calls coming into your facility. How are you helping them and serving them?
Well, we're trying to help them through psychotherapy. We're also directing them toward resources in the community if that's appropriate. Many of our young parents are getting very stressed. As one parent told me just yesterday, I was okay when summer was 2.5 months with my children, but now that it's 5.5 months, it's really starting to wear on me. Meanwhile, my boss says you need to keep working, even if you're working from home. So we're trying to work with them. We're trying to get them the counseling services they may need. We're trying to get them any external resources out there that are available.
And what about parents? How can they help their children with this sense of heightened fear right now?
Well, as parents, what you have to do with your children is try to understand that they are feeling the same types of anxiety that you're feeling. So when they see an anxious mom or dad, then they're thinking, well, there must be a reason to be anxious, and so they'll start to feel anxious, even if they don't really understand the full complexity of the situation. What you need to do is sit down and talk with them at an age-appropriate level. Of course, obviously, you don't talk to a 4-year-old the same way you talk to a 14-year-old. So you want to have that conversation with them. And you also want to try to have some fun. You know, kids are supposed to have some fun every day, and they need to get their exercise, and they need to get outside and play, obviously following social distancing rules. But they need to get out and try to enjoy the summer as much as possible. And so in a safe way. So anything you can do to help make their lives as normal as possible during this time.
So, Dr. Lucas, if someone is diagnosed with COVID-19 and they're forced to stay home and quarantine, what are some ways they can deal with the stress and anxiety of that situation?
Well, one of the worst things about getting sick with COVID is that you're having to quarantine yourself, and that often means long hours alone. As I said earlier, social media can at times be toxic, but FaceTime, Zoom, Google Chat, things like that where you can connect with people is extremely important. So you need to reach out to your family, let them know what you're thinking, let them know how you're feeling, and try to have the same types of social interactions. Obviously, it's more difficult when you're quarantined, but try to have those same social interactions as much as possible as you would if you weren't sick, so that you don't feel so lonely, and so you can bounce things off the people you love and trust, so that if you're thinking something, it may not be exactly the truth. And so sometimes if all you do is think through yourself, your thoughts can get away from you and you can start feeling some pretty bad ways.
Dr. Lucas, social distancing can cause people to feel alone. How do you suggest that they continue to connect with others?
Well, we have all these tools in our toolbox these days that we didn't even have 3 years ago, where you can use Zoom, you can use Google Chat, you can use FaceTime, connect with people, talk to people that you love and trust, get to know what they're thinking, let them know what you're thinking. Any way that you can do that so that you're just not feeling as isolated and alone, and so that you can hear from other folks what's going on in the world so that you can keep up with family, keep up with friends. I think it's very important.
Dr. Lucas, what are some easy ways that someone could unwind and maybe take their mind off of the current health crisis?
I think it's very effective if you just take a walk. That is the safest exercise. It's the one where you don't have to be in the best of shape to do it. I know it's very hot these days, so perhaps you want to do that in the morning or late in the afternoon. But just taking a walk, reading a book, watching a movie, something that gets your mind off your current circumstance, I think can be very effective. And it will last past the time that you do those activities. It's been shown in studies that your brain actually changes during these types of activities, and some of those changes will continue even after that. But you got to do it on a regular basis. Meditation, prayer can also be very effective.
So if someone is feeling down, stress and anxiety start to build, how do they know when they need to give someone a call to seek help?
I think anytime that you're starting to have feelings of hopelessness, feelings of worthlessness, feelings that life isn't worth living, certainly if you're having thoughts of suicide or if things are becoming violent at home in other ways, I think then you need to reach out to people. In a situation where perhaps things have gotten way out of control beyond the point of being able to wait on an appointment or to talk to somebody, you may have to call 911. If you're starting to have thoughts of wanting to kill yourself or thinking of ways that you may kill yourself, or if you're starting to think that your life has become worthless to the point where you can't go on, that's an emergency. And at that situation, 911 is an appropriate use for that. You may also want to go to your nearest emergency room if things are becoming out of control to provide a safe place to be. Unfortunately, because of just how severe things have been and how many more people are feeling the stress of the current situation, it may be very hard to get in with a mental health professional very quickly. There aren't a lot of mental health professionals in the state of Alabama, and so a lot of them are pretty busy. So if it's an emergency, you definitely need to use the emergency services.
Dr. Lucas, someone may have a friend or a loved one that's going through a really hard time. How do you suggest that they reach out to that friend or loved one and help them?
I think the best way to do it is to listen and talk to them after they finish telling you the full story and get them to talking about what's going on with them. A lot of times once a person starts talking with you as a friend, they recognize the therapeutic benefit of just talking. And I think at that point it's easy to step in and say, hey, this might be something that you want to talk to with somebody who's trained to deal with these situations, who can help you to come up with a new plan for how to fix some of these problems. I think that it's usually better to listen twice as often as you speak. And a lot of times people who trust you will listen more to what you say after they've told their story. Most people who are under stress want to tell you what's going on. And so I think it's important to listen first and then make those recommendations.
Dr. Lucas, have you seen an increase in telehealth appointments, and how are those helping your patients?
If you had asked me that same question 3 months ago, I probably had 2 or 3 virtual or telepsych visits a month. Now I have 15 a day. Most everyone would rather do things virtually at this time because of the COVID virus, also because of parenting responsibilities. It's harder to kind of get to the office, see people in the office if you got to take care of your kids at home. It's becoming the new normal for our field. It's really helped to expand our access. Many of the patients that we treat here at Baptist have to drive upwards of 100 miles just to get to the office because we cover such a large area. The ability to speak to somebody either on the internet or through actually just a telephone call has actually helped to expand access greatly to the more rural counties surrounding us. Most insurance companies do pay for telehealth at this time. You need to check, obviously, with your own insurance company, but almost everyone during the pandemic has converted to a telehealth coverage option. Almost everyone in our office is doing virtual visits these days. And so we've become quite accustomed to how to do that. And there are some things to get used to, but most people really kind of like it after 2 or 3 visits. It's so much easier and so much more private too, which they like.
So what advice do you have for someone who has a loved one or a family member that's elderly and maybe homebound?
Well, it's very difficult in a socially distanced time. I think it's important that you help your elderly loved ones with the new technology, because for many of them it may be the first time they've used FaceTime. It may be the first time they've used Zoom. It may be the first time they've used Google Chat. So the ability to help them understand that as much as possible is going to be helpful. That age group, as we know, is one of the groups that has the highest chance of having complications if they are to get the COVID virus. So I think it's extremely important that you continue the social distancing, but you've got to talk to them even more. Many of them have never been through something like this, and they're used to seeing their grandkids, and they're used to seeing their kids, and they're used to the things that they used to do in order to socialize. They've lost that ability. So you've got to reach out daily and talk to them, interact with them, use any of the platforms that you can to get in touch with them. I think it's extremely important.
Dr. Lucas, what's your advice for the use of social media right now?
I believe that social media can be an effective way to help reach out to people that you love and care about. It, however, can provide some fairly toxic ideas that may or may not have validity. And so my fear is that if you look at it too often, then you're going to start to believe things about yourself and about your world which aren't true, and you may negatively compare yourself to other people on social media. That's the danger of it. The beauty of it is you can contact people all the time who are on it, who know you, who care about you, and who love you, and keeping that contact is extremely important during these times where we're distanced from each other.